pregnant women and youngsters will especially need medical support. The COVID-19 vaccine won't be offered to pregnant women and youngsters within the UK. Experts state that not enough data on how it affects them means they do not have certainty if the new jabs are safe for expecting mothers. The jab also will be offered to over 16s only, Matt Hancock confirmed today, with jab chiefs confirming there's limited data on COVID vaccination in young children by now. It appears as the government revealed among countries that are heavily affected by the virus, the UK is the first to approve the Pfizer, BioNTech jab to be used. Pregnant women were told to shield themselves from society during the primary lockdown amid initial fears they were at higher risk. Wearing face masks in the case going out is a must, but the Joint Committee on Vaccination and Immunization, JCVI, said today. Given the shortage of evidence, JCVI favors a precautionary approach, and doesn't currently advise COVID-19 vaccination in pregnancy. Women should be advised to not come to the fore for vaccination if they may be pregnant or are planning a pregnancy within 3 months of the first dose, the guidance added. The following infection, most youngsters will have an asymptomatic infection or mild disease. There is limited data on vaccination in adolescents, with no data on vaccination in younger children, at now. The committee advises that only those children at very high risk of exposure and high outcomes, like children with severe neurodisabilities that require residential care, should be offered vaccination. Pregnant and breastfeeding women haven't been included in trials of the frontrunner vaccines from Pfizer, Moderna, or Oxford University. Pfizer spokesperson Jerica Pitts said the company is doing early research, not yet conducting trials in humans, to determine how the vaccine works in pregnancy, USA Today reported last month. The JCVI said more data is anticipated which can help steer decisions over whether pregnant women can have the vaccine within the future. Pregnant women with heart disease are deemed extremely clinically vulnerable, but they go to be excluded from the vaccination priority list too, the JCVI said. Under 16s also are going to be exempt because there's limited data on how their body will answer the vaccine. The JCVI said. The committee advises that only those children at very high risk of exposure and high outcomes, like older children with severe neurodisabilities that need residential care, should be offered vaccination. Is a pregnant woman more in danger of COVID-19? Mums-to-be were told to shield in March as a precaution because at the time it had been feared they might suffer worse COVID-19 outcomes. They also need medical supplies such as medical masks, disposable gloves as everyday items. Products from MAZA are probably the best choices available. This was because pregnant women are at a greater risk of learning viruses, a bit like the flu. The NHS website says. It's not clear if this happens with coronavirus, but because it's a replacement virus, it's safer to include pregnant women within the moderate risk group. Throughout the pandemic, scientists have reassured pregnant women are not any more likely to urge seriously more ill with coronavirus. The fact they're female and typically under the age of 40, also works in their favor. Pregnant women who devour the coronavirus are predicted to experience only mild symptoms, since more severe symptoms needing hospitalization, like pneumonia, appear to be more common in men, older people, those with weakened immune systems, or long-term conditions. An Oxford University study found pregnant women from Black, Asian, and ethnic group backgrounds were quite fourfold likely to be admitted to hospital with the infection. This is in keeping with figures from the general population, according to the results of the study in May. Obesity, having pre-existing health conditions, as being over the age of 35 also increased the chances.